Hi, my name is Dr. Sara Beattie. I'm a clinical psychologist at the Tom Baker Cancer Center in Calgary. I specifically work with individuals and their support people going through stem cell transplants and those with blood cancers. Today, as part of the BMT101 webinar series, I'm going to be talking about common psychosocial challenges of both patients and caregivers, as well as some tips for coping, some practical tips. So in terms of the goals and objectives of today, just the three things I'm hoping to cover are to understand the emotional impact of transplant on patients and caregivers. I want to suggest some evidence-based strategies to cope that you may be interested in implementing, as well as share some resources such as self-management, as well as some signs and symptoms you may benefit from seeking professional support. So here's a conceptualization of quality of life that demonstrates that there's many different components of quality of life. So if we kind of look at activity and participation, that might include things such as family and social network, work life, sexuality, planning for the future. Symptom status may include things such as pain and fatigue. Biological status could include things such as peripheral neuropathy. Treatment factors would be current treatment regimen and coping with treatment side effects. That support health services would be communication with healthcare providers, and then the support non-health might be financial concerns, housing, maybe if you're from out of town and getting a transplant somewhere else, that could also be included there. And then emotional status I have highlighted because we're going to go into that further. So highlighting some of those emotional or common psychosocial challenges that patients may encounter. We do see distress, and distress has been defined as kind of that a multifactorial, unpleasant emotional experience of a psychological, social, or spiritual nature that might interfere with your ability to cope effectively with cancer, its physical symptoms, and its treatment. Often it's on a continuum ranging from, a more normal feeling of vulnerability and sadness and fears to a higher level of distress that might become more debilitating. What we see is that it's often highest prior to transplant and then does decrease over time. Other psychosocial challenges include, fears, worries, sadness, a sense of a loss of control or independence. Feelings of helplessness get cited as well. Feelings of isolation, particularly during this COVID pandemic, has been heightened. Some people will say they feel worried that they're being, quote unquote, a burden to their loved ones, and then they feel a need to protect their support people. Other challenge that patients face, throughout the transplant experience are changes in roles and relationships, fears of cancer recurrence, challenges tolerating uncertainty. Some people will also share having cognitive challenges, which often people call, brain fog or chemo fog. And we do find that many people recover their cognitive function within 1 year, but some people do show mild impairments up to 5 years post-transplant. People share challenges with their mental health, such as anxiety and depression. And I want to mention that it's pretty normal that past mental health difficulties, such as previous depression or anxiety, can come back, because that is a normal thing that happens when we face highly stressful situations. People will say, following transplant, that they may have trouble navigating a new normal. I know this isn't a term that everyone likes, that new normal, but just they may have trouble just readjusting and returning to previously enjoyed activities, as well as, potential challenges returning to work or to school. One of the things that I think is really important to highlight is that even the most resilient people can find this challenging, and you may or may not experience some of these, but just to notice that these are experiences some people do have. On the caregiver side, we see that there are many different caregiver roles that different caregivers do take, and this may or may not be the case for you, but it can range from, being someone's companion to the record keeper or the scheduler, or really having to be their advocate in clinic or on the unit, as well as the cheerleader or the chef. Sometimes they become the emotional support, as well as the child care provider. If you have children, can also be a surrogate decision maker. So the roles of the caregiver do range. And what do we see as the emotional impact of caregiving? We see a high prevalence of distress in caregivers as well. Some will demonstrate signs of anxiety. Typically, signs of anxiety are more prevalent than signs of depression, but both do occur. And interestingly enough, we see that in romantic relationships, when a romantic partner is a caregiver, that often those partnered caregivers report higher levels of distress than the patient themselves. We also see challenges balancing those competing demands, the demands of caregiving, maybe continuing to work, maybe balancing the finances, as well as any other tasks such as commitments to family or friends or other hobbies or priorities. So often caregivers will mention challenges prioritizing and maintaining self-care. And then in terms of patient and partner psychological experiences, we know that they impact one another. When patients are distressed, partners tend to be as well, and vice versa. And one of the most important things is that, caregivers or support people, whatever term feels best for you, that experience is unique and intertwined. So it will be in some ways similar to the patient, and in some ways quite different. So I'm going to switch gears a little to talk a bit about coping. So I'm going to start with more of the preparation and coping during hospital admission, knowing that each site has, maybe slightly different ways they do transplant, and maybe some may be more outpatient-based, whereas some may be more inpatient-based, but this is mostly during that hospital admission piece. So in terms of that preparation, we'll often say, to the best of your ability, try to create some routine in hospital, planning. So bringing in those strengths and hobbies, bring them in, get creative, bring in a picture of family or something that reminds you of what you're going to be going home to. Asking for support as needed. And I have survival mode in quotes, and that's because some people will say that they kind of enter a bit of a survival mode where they will understandably focus more on their physical symptoms during that time because they're going through so much. And I always say that just to give people a heads up that sometimes we'll find that people do kind of enter that survival mode, and then, maybe 6 months post-transplant, we'll notice all the more emotional pieces of their transplant hitting them, and that will be when they decide like they need to talk about getting more emotional support. So again, strengths and hobbies, bring them in, get creative, walk and move as much as possible, as much as your medical team recommends during that admission. That does help with strength as well as mood. Consider doing mini mindfulness meditations. There's some great apps out there. Also, there are relaxation strategies. I'll give some resources for those on the end. And feel free to ask about psychosocial or spiritual care during the admission process if you have access to that. What about coping for caregivers, particularly while the patient is admitted? So we recommend that caregivers need to practice self-care too, kind of going with that, I guess, a bit of that statement that often is said, we on the airplane, putting your own oxygen mask on before assisting others. So we know that caregivers need to take care of themselves so that they can also continue with their caregiving. So taking breaks, prioritizing personal time, getting good sleep, nutrition, exercise. One of the times, at least at our center, we'll say, consider taking advantage of time when the patient is admitted, because they're well supported on the unit by the medical team. Communication of your needs to the patient, to the medical team, as well as to potential other support people. Can you get others engaged in helping? Can there be a schedule? Often people will think of one person having only one caregiver. If it's possible within your network of support, could other people be engaged in that supporting? Here's a few caregiver-specific resources. There's a great Bill of Rights and a self-care handout on the Caregivers Alberta website. And then thinking about coping together. Open communication is one of those things that's really important. Research has shown that both patients and caregivers tend to hide their own fears and worries in an effort to protect each other. But what we actually know is that results in each person's distress going up. Often that open communication, assertive communication really helps. Again, remembering that experiences are individual and unique. There will be overlap, but there will be pieces that feel different. Other tips for helping others help you, and this is for both patients and caregivers, so that communication of needs. I'll often say too, people will often call and offer some help, how can I help? But that can feel overwhelming if you don't know how they can help at the time. So sometimes that is, as you can think of, tasks that you could use help with, is that getting some groceries or a meal, or even, if it's the wintertime, maybe the snowfall, or helping with the lawn, those kinds of things. Just write those tasks down as you come up with it. And if someone does call or send a text offering support, could you delegate and give them those specific jobs? There are websites to facilitate support networks out there too. And one of the other things is to remember that accepting help from others can be challenging and take practice. So notice if it's difficult for you, and know that if you keep practicing it, it will get easier over time. Some other kind of tips on how to cope with some of the most common things that we see. So tolerating uncertainty is definitely one of the things that understandably is something that we see people and caregivers undergoing transplant encounter. So what we know is that worry is a way to anticipate future threats and is a form of kind of vigilance. So often people think by worrying about cancer getting worse or coming back, maybe I'm more likely to be ready for it. However, what we do know is that in many cases, worry actually increases uncertainty and raises anxiety levels. And the thing that we're worrying about cannot be resolved by worrying about it. So worrying, we know it can be adaptive when we're worrying about something we can change. So something that's within our control if we see that circle. So often it's helpful to pause and to identify what might be in your control. So some examples might be attending your medical appointments, taking care of yourself from an emotional perspective, and then what is outside of your control. And those are the things where we want to engage some of these other coping strategies I'm going to be discussing. So cancer fear is also kind of along the same continuum, and this is one of those pieces that is going to be a further coping strategy. So knowing your triggers. Are there certain things that may trigger the worry or those fears? Also acknowledging that fear will happen. That's normal. Like a small box in your head, it will come out occasionally in response to triggers. Acknowledging the fear, experiencing it for a few moments. Is there anything it's telling you? And then decide how to move forward. Can you do something about it? If that's within your control, are there any problem-solving things you can do? If not, have a coping plan. Some other things you can do when you encounter cancer fears are ask yourself, can you do something to change the situation? Could this be something like getting closer to some people? Getting what we'd recommend is a 20-second hug, breaking down the problem into manageable parts, getting some more information. Can you do something to feel differently about the situation? This is doing relaxation exercises, maybe writing in a diary how you feel, using some self-talk phrases. This would actually be, the feeling different would be a great time to use that 20-second hug where that allows a release of oxytocin. And then can you think about your situation differently? Some questions you could ask yourself are, this could be something such as considering what would be an alternative point of view. Or is this particular thought helpful to you in this situation? Those may be some things to consider. When we talked about what would coping look like in terms of calming self-talk, that's the use of personalized sentences that you repeat to yourself each time you need to relax and find peace. So it's a skill that can help you decrease intrusive thoughts by learning to talk to yourself using calming and comforting words or sentences. One of the things that's really important to remember is that it wants to be calming, but also feel realistic. And it needs to be something that resonates with you. So I'd strongly encourage you to formulate your own calming self-talk phrases. Here are just some suggestions that you could use, but it really does have to be something that makes sense to you. So it could be something like, I'm scared, but whatever happens, I can cope. Or I'm calm, relaxed, and focused. I can deal with the stress. This feeling of uncertainty is only temporary. Another way to come up with calming self-talk is to think, what would you say to a loved one, or a loved one who told you in the past? What is something a loved one's told you in the past that's helped you feel like you can cope? Those are kind of great ways to come up with those self-talk phrases, and writing them down so that you can refer to them when you're feeling stressed or anxious or fearful. What are some other coping ideas? One is just to spend time with family and friends, participating in hobbies or other enjoyed activities. Again, this is within your current physical limitations. Taking a walk and exercising as you're recovering from transplant and feel up for it, and again, within your current limitations. Talking about it with someone you trust, whether that be with friends or family or with a professional. Again, trying some meditation or relaxation techniques. This can be something you, again, do on your own with an app, or that you contact a professional to assist with. So kind of along the lines of meditation, I'm going to touch briefly on mindfulness and the benefits of being present. So this is another evidence-based approach that I'd like to introduce today, and it can be a powerful tool to cope with the sense of uncertainty and lack of control that might be associated with your experience. Many people have heard of mindfulness at this time. It does come from Buddhist origins, but interest in mindfulness removed from its Buddhist origins has grown exponentially in healthcare settings and research labs around the world. It's also gotten a lot of attention lately in the popular media. And this is kind of one of those big things. So what is mindfulness? It's developing awareness of all that is happening in the present moment without judging or evaluation. So it's kind of wanting to be here and now with non-judgmental acceptance, with trust, with that focus on the present rather than a focus on the past or the future. Learning to connect with your own body and focusing on your body or breath while seated, walking, or lying down. So often we think of mindfulness in that more formal practice, which would be kind of that seated or lying down, and that has a large important place, but there's also informal practices that you can pay attention to and do as well, which may be, while doing dishes, just bringing your mind back to the moment and noticing your breath, or even on a walk in nature. And it's that idea of just turning off autopilot and being in the present here and now. So again, that's sort of what I just walked us through. It's a great way of approaching challenging thoughts and feelings, and its focus is on that present within a framework of non-judging, acceptance, and patience, that we learn to focus awareness on that breath and sensation. So what are some benefits for cancer patients? Reduce symptoms of anxiety and depression, reduce perceived stress, improve sleep and fatigue, as well as improve quality of life, enhance spirituality and meaningfulness, increased sense of mindfulness, so being here in the present moment, reduced rumination, so kind of thinking about the past, and then also reduced worry or fears of the future. It actually also has some biophysical markers as well, so improved stress hormone profile and immune system markers, reduced blood pressure. And if you do a program, so this was done through different RCTs found, and we do have a really great mindfulness program that we're fortunate to have here, but many of those benefits are maintained after the program ends. So when Is it helpful to seek psychosocial support? So firstly, it's important to investigate what psychosocial supports you do have available at your center or in your local area. But common times that it might be really helpful are if your emotions or thoughts feel overwhelming. It is normal to experience distress or sadness, but if it's starting to feel like it's interfering with your daily life and that you're getting stuck on those thoughts, that is time to seek support. If you're physically improving, but still having challenges re-engaging in previously enjoyed activities, or you're noticing you're not enjoying them, that is a time to seek additional supports. Challenges with communication, whether that be with a loved one or with your healthcare team, that can be a time also. Challenges adjusting back into your roles. Some people also just say they really want a safe place to discuss their emotions and their experience related to cancer and transplant. So in summary, we know that both patients and caregivers may experience distress during this transplant process, and those experiences are both unique and intertwined. Coping, so I highly suggest drawing and building on previous coping strategies, as well as trying some new strategies. They may be some that included today, or you may seek out some others. Seeking the support of a mental health professional specializing in cancer care as needed is also a great one. So just a list of resources for you to check out. So Cancer Chat Canada has a list of resources, and it includes this new care manual, Living Well, so essential skills for people affected by cancer, as well as if you're having some sleep challenges, it does have the Sleeping Well, I Can Sleep manual, which is I was going to say CBT, but a cognitive behavioral therapy for individuals with insomnia cancer. It's a great manual. There's also this A Cancer Patient's Guide to Overcoming Depression and Anxiety is another reference. If you're interested in mindfulness, our program's mindfulness was developed by two of my colleagues, Dr. Carlson and Dr. Specka, and they have a book that they wrote, and it kind of takes you through a step-by-step treatment plan, which is wonderful. And so kind of more on less cancer specific, more just on anxiety and other mental health challenges. Anxiety Canada has really amazing resources for anxiety, including a MindShift app, which is free, and it has under the chill zone, it has some great breathing strategies, as well as a quick mental vacation, some progressive muscle relaxation. The Center for Clinical Interventions has some good resources for looking after yourself that you can go through and see if there's anything there. And then lastly, just free workbook. Well, first, Mind Over Mood, change how you feel by changing the way you think. Again, that's for people with depressive symptoms, and just a great general resource, as well as the antidepressant skill workbook, which is free online. Again, thank you very much, and I am finished this talk.